Here are 4 things nobody will tell you about your next pregnancy. Now, you may be pregnant for the first time. This video is not actually for you, but you can learn to prepare yourself for your next pregnancy. If this is your second pregnancy, your fourth pregnancy, or even your fifth pregnancy, here are 4 things that nobody will tell you, but I'm here to tell you for free. So sit back and listen carefully and get yourself ready, all right? I'm Nelo. Don't forget to subscribe to my YouTube channel. Now let's get into the topic. Now, when a woman gets pregnant, there are things that will happen to her at every stage of her pregnancy. If this is your first pregnancy and you're still below 25 years, you may not understand what I'm saying, but if you are older, then you really get it. So number 1, your next pregnancy, you are now older. So you are not as young as you were when you gave birth to your first baby. So if this is your fourth pregnancy, when you gave birth to your first pregnancy, you saw how fresh and vibrant you were. But now, it's as if the pregnancy is like a burden. So we tend to react to pregnancy according to our age. A 21-year-old girl pregnant and a 30-year-old woman pregnant, they will not react the same. Maybe you gave birth to your first child when you were 22 years, and now you are 30, you're giving birth to your fourth child or your fifth child. The reaction is going to be different. You cannot be jumping up and down. You cannot be stressing yourself anyhow. You have to be cautious, because anything you do now might tell on you in that pregnancy. So one thing people will not tell you is that the older you get, the more pregnancy becomes stressful. The older you get, the more you are exposed to stress, pregnancy complications, and so many things that may come. Even the older you get, the higher risk of miscarriage you might even have. The older you get, the higher risk of stillbirth you might even have. Once you get pregnant and you know that your age is no longer below 25 or even below 30, you just have to be very careful with yourself. Okay? Now, number 2. If this is your next pregnancy, second, third, or fourth, just know that the symptoms might double. If you had headache for like 1 week in your last pregnancy, this one might double. The complications might double. If you had preeclampsia in your last pregnancy, you will have preeclampsia again. The possibility of having it again, and this time around, is going to be very much, the complications will be so much unless you start on time to manage them. I have clients that live in the UK whereby in their last pregnancy, she had, the person in particular, she had preeclampsia. When she got pregnant again, they didn't even wait for her to start showing the signs of preeclampsia. They placed her on aspirin. So it's to show that if you have had preeclampsia before, you might have it again. So they placed her on aspirin, and throughout that pregnancy, her blood pressure was controlled, placenta function was controlled until she gave birth to that baby. She did not have symptoms of preeclampsia again. So the older we grow, or the more pregnant we become, the risk becomes higher. If you have given birth through CS before, in your next pregnancy, the risks are higher. But that does not mean that they cannot manage those risks. It does mean that you have to be very, very careful with yourself. Do you understand what I'm saying? Okay. Number 3. When you get pregnant for your next baby, you now find out that the outcome might be serious or even better. Let me explain. For a woman that had diabetes in pregnancy, in her last pregnancy, and it was maybe properly managed, in this pregnancy, they will look out for it. Like they will wait for it. If you had chronic anemia in your last pregnancy, in this pregnancy, they are supposed to look out for it. So you're supposed to be ready. Very, very ready for complications, ready for eventualities, ready for anything that will make this pregnancy to be stressful on you. So you have to be very careful. Don't say, I've given birth to 4, I'm a pro. You are a pro, but you are also at risk of bleeding. Did you know that a woman that has given birth before is more at risk of postpartum hemorrhage than the one that this is her first pregnancy? Did you know? Because the moment you have given birth to 1, 2, and you come to my hospital, we are ready for you. The moment you give birth, we will monitor you closely, because the possibility of having postpartum hemorrhage is high. So you have to be very, very careful. This is one of the reasons why you must not deliver your baby in a rubbish place.
I'm not the here one.
In a nonsense place. Don't say, I've given birth to 4, so I will go to this place. That woman in my compound knows how to deliver babies. You go and give birth to your 5th child there. You might come down with severe postpartum hemorrhage and you may not like the outcome. So the more you give birth, the more you are at risk of so many things. So go to the good hospital and deliver your baby there. Then the last one on my list now is that your next pregnancy needs more attention than your last one. Maybe when you were pregnant for your first baby, you used to go for antenatal once every 3 months. In this one, you must go for your antenatal visit every month or every 2 weeks, depending on your case. In this one, you must be close to your doctor or your midwife. In your next pregnancy, you must be at alert. If you had diabetes in the last one, this one, you have to get a glucometer for yourself. Your hospital need to teach you how to do your own blood test. If you had preeclampsia, you need to go and buy a sphig. That is the equipment they use to measure blood pressure. You have to get it. If you had maybe a problem, maybe you had problem in your last pregnancy, this one, get a fetal Doppler. Fetal Doppler to monitor your baby. You have to be proactive in your next pregnancy. Don't take things for granted. Maybe your last pregnancy, you're not having any problem. This one, I'm not saying you should expect problem, but you have to be ready for it. Because as we grow older, pregnancy becomes more risky. So you have to be very careful. I know this is one truth that nobody wants to know, but this is exactly how it is. So many women fail to understand that the older they get, the more problems they might have in pregnancy. So they tend to take things for granted and end up in severe complications, either during childbirth or after childbirth. So once you drop 1, drop 2, the third one, you have to be ready. Don't say, I've given birth to 2, so I'm okay. No, the risk is higher in your 3rd pregnancy. So make sure you get ready. So if you are watching me and you have been diagnosed with any high risk conditions in your pregnancy, do not fret. Just make sure that you are in close proximity with your healthcare providers and they are giving you the right information about your condition and you are following their instructions. You will give it to your baby and there will be no problem. All right? Okay, thank you so much for watching. I'm Nurse Nelo, always at your service. Don't forget to subscribe to my YouTube channel. Click the notification bell so that when I post videos like this, you'll be the first to see them. I'll see you in my next video. Drop your questions and comments and I will attend to them. Bye.